with severe pain in Mr. Fernandez. Coming in with abdominal pain for the past 3 days.
Okay.
Can you please inspect and do upper abdominal examination?
Good evening, doctor. This is my GMC number. I understood my task. Shall I proceed?
Yes, please.
Thank you. Hello, Mr. Fernandez. I'm Dr. Mohan, one of the doctors in this department. I'm here to examine your tummy.
Yes, fine, doctor.
Is it okay?
That's fine.
So, for the purpose of examination, you need to undress above the waist,
Okay.
and I'll ensure adequate privacy since it's a private room.
Alright.
I'll also ask my examiner to kindly beat the shot.
Alright.
Is it okay?
That's fine.
I'll be verbalizing my findings side by side to the examiner, so kindly bear.
Yeah, no problem.
Will you please raise your hands like this? Thank you. I couldn't appreciate any clubbing, I couldn't appreciate any pallor, any nicotine staining or koilonychia in my patient. Could you please raise your hands as if pushing a wall or stopping traffic? There is no flapping tremor in my patient. Will you please show your palm for me, Mr. Fernandez? I couldn't appreciate any pulmonary edema. There is no wasting of pinna, hypopinna muscles. Thank you, Mr. Fernandez. I'll be looking for your pulse in your hand, Mr. Fernandez. Ideally, I should have counted the pulse rate for 1 minute, but I'm counting it for 15 seconds due to time constraint. Pulse rate in my patient is 72 beats per minute. Ideally, I'll measure the blood pressure. Mr. Fernandez, could you please look up for me? Please look down. There is no icterus, there is no pallor. Could you please open your mouth for me? Could you please stick your tongue? Could you please roll it back? I couldn't appreciate any after ulcers. There is no central cyanosis. The oral hygiene seems to be normal, and I couldn't appreciate any nicotine stains also. Could you please tuck up your trousers, Mr. Fernandez? Thank you. I couldn't appreciate any pedal edema. Mr. Fernandez, now I'll be examining your tummy. Could you please take a deep breath in and out? Thank you. The abdomen moves with respiration. It is scaphoid. Thank you, Mr. Fernandez. This umbilicus is centrally placed. It is inverted in nature. I couldn't appreciate any abdominal distension. I couldn't appreciate any visible swelling, any scars, any sinus, I couldn't appreciate any visible pulsation. There is no visible peristalsis as well. I couldn't appreciate any caput medusae, any spider nevi or gynecomastia in my patient. Now I'll be gently touching you for examination purpose. So, is that okay for me to proceed?
That's fine.
Couldn't appreciate any localized rise in temperature. Mr. Fernandez, can you please tell me where do you feel the pain? Okay, are you comfortable right now?
Yes.
I'll be first gently touching you and then a bit more deeply. Okay? Really sorry. You okay? Shall I proceed?
Yeah.
My patient is having tenderness on right hypochondrium on superficial palpation. Could you please take a deep breath in and out, Mr. Fernandez? Are you okay right now? Shall I proceed? My patient doesn't have any hepatomegaly.
Okay.
Could you please take a deep breath in and out? Murphy sign is also positive in my patient. Sorry to bother you, Mr. Fernandez. Could you please take a deep breath again? I couldn't appreciate any splenomegaly. Mr. Fernandez, is that okay for me to tap you from
It's okay, we
the
don't
tummy?
need the
Okay?
Alright.
And from the chest as well.
Alright.
Could you please hold your hands over here? Yeah, thank you. Thank you, Mr. Fernandez. The liver span seems to be approximately 8 centimeters. Thank you, Mr. Fernandez. I'll be tapping in your tummy right now. I couldn't appreciate any flank dullness. Mr. Fernandez, I'll be listening to your tummy with a stethoscope.
Okay.
Assume that you hear the bowel sound.
I could appreciate the bowel sounds. There is no aortic brain in the patient. Thank you, Mr. Fernandez. You've been very cooperative. Now you can dress up. I'll be talking to my son.
Thank you.
Ideally, I'll complete the upper abdominal examination. We're looking for the supraclavicular loop of lymph nodes. My most probable diagnosis: patient is having acute cholecystitis. Since he is having tenderness on superficial palpation, right hypochondrium, orthomorphic signs of the positive. Thank you.
Srinivas, who came to your surgery orthopedics department.
Do you know his name?
Yeah.
Okay.
With pain on his elbow.
Okay.
And kindly examine the patient and
Is it a sports personality you told or something?
he's an amateur player. Amateur tennis player.
Okay.
Okay.
Make a
So
professional tennis player.
okay, so examine the patient and make a diagnosis and discuss the same thing with the patient.
Okay. Good afternoon, doctor. This is my GMC number.
Okay. And proceed.
I understood my task. Shall I proceed?
Yeah.
Thank you. Hello, Mr. Srinivas.
Hello, doctor.
How are you?
I'm good, doctor. How are you?
I'm also good, thanks.
Right.
I'm going to examine your elbow joint.
Okay.
Can I know which is the affected one?
My right elbow, doctor.
Are you okay right now?
I've been having some pain for some time.
Okay. I would like to give my patient painkillers, please.
Yes. This is immediately.
Are you okay right now?
A lot better, doctor.
For the purpose of examination, you need to undress above the waist,
Okay.
and I'll ensure adequate privacy since it is a private room. I'll also ask my examiner to kindly be the shot.
Alright.
Okay?
Okay.
Could you please stand up with your palms facing forwards like this? I'll be verbalizing my findings to the examiners. Kindly bear with me.
Alright, doctor. That's fine.
Ideally, I should have started my examination by examining the normal joint, but I'm just focused on the affected joint due to time constraints. On inspection, both the shoulders, both elbows, both wrist joint are symmetrical in position. I could appreciate increased carrying angle on the right side. There is no discharge, there is no redness, swelling, bony deformity or muscle wasting on the anterior aspect of the right elbow joint. I'll be going behind you now, Mr. Srinivas.
Yes, fine.
I couldn't appreciate any redness, any swelling, any deformity, muscle wasting. Couldn't appreciate any olecranon force of fullness or any cubital force of fullness.
Alright.
I'll be touching you gently, Mr. Srinivas.
That's fine.
Okay? If you have any discomfort, let me know.
No problem.
I couldn't appreciate any localized rise in temperature. I'll be touching you a bit more deeply now.
Alright, that's fine.
I'm really sorry. You okay?
Fine.
Shall I proceed?
Yeah.
Patient is having tenderness over the lateral aspect of the right elbow joint. Could you please bend your elbow? Thank you.
Alright.
I'll be gently twisting your forearm.
Alright.
I could appreciate the radial head. Could you please bend both the elbows for me? Thank you. I'll be going behind you now. Could you please straighten it now? Thank you, Mr. Srinivas. Medial epicondyle, lateral epicondyle and olecranon process seems to be in straight line in my patient. Now I'll be asking you to do certain movements,
Okay.
Mr. Srinivas.
Alright.
Could you please bend both the elbows down for me like this? Could you please straighten them? Thank you. Flexion is limited in my patient, extension is normal in my patient. Could you please tuck your elbows in your tummy and then move your palms downwards like this and then upwards like this. Thank you. Supination is limited in my patient, pronation is normal in my patient. It won't be the case, I have to do the special test. So I'll be doing some more special tests, Mr.
Okay.
Srinivas.
Alright.
But okay?
That's fine.
So could you please bend your right elbow? Thank you. Would you please make a fist for me?
Okay.
Try to resist my movement. Would you please show your palms? I'll be gently moving it downwards. Cousins and Mills test is negative on supination. Could you please turn your palms inwards like this? Thank you. Could you please make a fist? Try to resist my movement. Really sorry about that. You okay?
That's fine.
Could you please open up your hands?
Yeah.
I'll be gently moving it downwards.
Okay.
You okay?
Awesome.
I'm really sorry.
Okay.
Cousins and Mills is positive on pronation in my patient. I'll be looking for your pulse, Mr. Srinivas. Could appreciate the radial artery. Could you please wriggle your fingers? Thank you, Mr. Srinivas. You've been very cooperative. Now you can dress up.
Thank you, doctor.
You'll take your seat now.
Thank you.
From what I've examined, you seem to have a condition called as a lateral epicondylitis.
What is that, doctor?
Do not be alarmed by the name. It's just a common condition in sports personality, especially
Okay.
like you.
Okay.
And do you know how you are going to manage this one?
No, doctor. No, doctor. Can you tell me?
Yeah, sure. That's the reason why I'm here. So for initially what you'll do is that we'll be giving you some arm sling for a period of 2 to 3 weeks.
Alright.
And don't worry about the pain. We'll be giving you appropriate painkillers to take care of your pain.
Okay.
So hopefully you should be alright in 2 to 3 weeks. And then we'll be following you up regularly and telling you
Alright.
when you can start playing tennis.
Okay, so in these 2-3 weeks I can't play my tennis.
You should take strict drugs, Mr. Srinivas. That is more important.
Oh my god. And what if these
I'm
painkillers
really
fail,
sorry.
doctor?
Sorry?
What if these painkillers fail?
Don't worry about the late steps. So there are some advanced method of management like injecting some special medication which my consultant will decide.
Okay.
So don't worry about it. We'll be following up and giving you appropriate advice at the required point.
Oh, that's great, doctor. Alright.
Okay. Here are some websites and leaflets. You can read more about the condition.
Okay.
If you have any doubts at any point, don't hesitate to contact me.
Alright, doctor. Thank you very much.
Thank you. So, examiner for this station. And one more thing, don't take history in examination station. Okay? Don't ask the patient what made you to come to the hospital and all. He'll be literally wasting time. I had pain 4-5 years back, doctor. He'll be telling you stories. So already you've got only 5 minutes. Keep it simple. If you want to ask history in certain examination station, tell that I learned from the notes that you had a problem. Is that right? Okay? Yes, doctor, that's right. And then tell the patient that I'm going to examine. If you want to know that this is your right patient having a right hip joint pain or left hip joint pain, whatever it is. Okay? So you can tell I learned from the notes. That's it. Okay? Otherwise, don't take history. And in any history taking, don't do the examination. Abdomen examination will be there. History taking, abdomen pain. Patient will be lying down. You'll enter the station. Since patient is lying down, you'll forget the task and start doing examination. Okay? Examiner will be asking, have you understood the task, doctor? Okay? Don't take history in examination. Don't do examination in history taking. Okay? So, who is going to be my examiner giving my task? So I'll do this as in GMC, the hip joint examination.
Okay, you have a 65-year-old male who has his name is Mr. Anderson, and he came in with
Different name.
Okay.
Don't practice with the same name.
Matthew. His name is Mr.
Yes,
Matthews. And he came in complaining of hip pain, difficulty walking for several months, and now it's becoming very debilitating, so he's in for an examination, please.
And discuss the diagnosis.
And discuss the diagnosis.
Thank you. Good morning, doctor. This is my GMC number.
Go ahead.
Thank you so much. Hello, Mr. Matthew.
Hello, doctor. How are you?
How are you? I'm fine.
Good.
Dr. Moore, one of the doctors in this department. I'm here to examine your hip joint. I learned that you have some pain in your hip joint. Is that right?
Yes, doctor.
Can I know?
Quite some time.
I'm really sorry about that. Are you okay right now?
I'm in some pain, doctor. I'm at
Okay.
right here.
I would like to give my patient painkillers.
Assume it's good.
Are you okay now?
Yes, doctor. Not right now.
Can I know which is the affected joint for you?
My right hip, doctor.
Okay. I'm going to examine your hip joint. For the purpose of examination, you need to undress below the waist, stay in your briefs, and I'll ask my examiner to be the chaperone and provide you privacy since it's a private room.
That's fine, doctor.
Okay. Could you please stand up with your outstretched hands like this? I'll be verbalizing my findings to the examiner, so kindly. Ideally, I should have started my examination by examining the normal joint, but due to time constraint, I just focused on the affected joint. On inspection, both the shoulders, both anti-superior iliac spine, knee joint, and medial malleolae are symmetrical in position. I couldn't appreciate any redness, any swelling, any deformity or muscle wasting on the anterior aspect of the right hip joint. I'll be going behind you, Mr. Matthew.
That's fine.
I couldn't appreciate any redness, any swelling, any deformity or muscle wasting on the posterior aspect. Mr. Matthew, now I'll be doing some special testing you. Is that okay?
That's fine.
Could you please raise your right leg for me? Could you please stand on your right leg and lift your left leg for me? I'm really sorry about that, Mr. Matthew. You okay?
I'm fine, doctor.
Trendelenburg test is positive in my patient. Could you please take a few steps and lie down on the couch for me? My patient is having limping gait. Couch is flat. I'll be measuring your limb length, Mr. Matthew. Is it okay?
That's fine.
If you have any discomfort at any point, let me know. I'll stop my examination. Okay. Both apparent and true limb length seems to be normal, equal in my patient. Now I'll be touching you gently for the purpose of examination. Is it okay?
That's fine.
I'll be as gentle as possible.
Alright.
I couldn't appreciate any localized rise in temperature. Now I'll be touching you a bit more deeply.
Okay, doctor.
I'm really sorry about that. You okay?
Yeah.
Shall I proceed? You okay?
I'm fine.
Sure.
Doctor. Sure.
My patient is having tenderness on the anterior aspect of the right hip joint. Now I'll be touching a bit more deeply in your groin region, Mr. Matthew. Okay? I'll be gently twisting your thighs as well.
Alright.
I couldn't appreciate any femoral head cavitations. Mr. Matthew, now I'll be asking you to perform few movements for me.
Alright.
Is that okay?
That's fine.
Before that, have you undergone any hip replacement or knee replacement surgery?
No, doctor.
Okay. Could you please raise your right leg for me without bending your knee joint? Thank you. Could you please repeat the same on the opposite leg? Flexion is limited in my patient. Thank you, Mr. Matthew. Ideally, I look for extension. Could you please cross your right leg on the left leg for me? Thank you. Could you please do the same in the opposite leg? Thank you. Adduction is normal in my patient. Could you please bring your legs towards the edge of the couch? Abduction is also normal in my patient. Could you please turn your toes inwards like this? Could you please turn your toes outwards like this? Internal and external rotation seems to be normal in my patient. Mr. Matthew, now I'll be doing some more special testing to find out what's really happening. Is it okay?
That's fine, doctor.
I'll be gently tapping upon your right hip joint.
That's fine, doctor.
I'm really sorry about that.
Oh, that's okay.
Where did you feel the pain?
That was my groin, doctor.
Okay. Trochanteric thumb test is positive in my patient. Now I'll be putting my hands beneath your back, Mr.
That's
Matthew.
fine, doctor.
Could you please bend your left knee joint for me and bring it as close towards your chest? You can use your hands for that if you want.
4 minutes,
Thank
30
you.
seconds.
Thank you. Thomas test is also positive in my patient. Ideally, I look for the neurovascular deficit. Thank you, Mr. Matthew. You've been very cooperative. You can now dress up. I'll be talking to my examiner. Ideally, I'll examine the joint above and joint below. My most probable diagnosis, my patient is having osteoarthritis since trochanteric thumb test is positive in my patient. Thank you.
He's a rugby player. He got injured his right knee. He's there for treatment.
What's the name?
Mr. Kane.
King.
Kane. K-A-N-E.
Kane, okay. So, good morning, doctor.
Good morning.
This is my GMC number.
Proceed.
Thank you. Hello, Mr. Kane.
Hello, doctor.
I'm Dr. Mohan, one of the doctors in this department. I'm here to examine your knee joint.
Alright, doctor.
Can I know which is the injured one for you?
My right knee, doctor.
I'm really sorry about that. Are you okay right now?
Yes, doctor. I'm
Okay.
fine.
I'm going to examine your knee joint to find out what's happening.
Alright.
So for the purpose of examination, you need to undress below the waist and stay in your briefs.
Okay.
And I'll ask my examiner to be the chaperone and provide you privacy since it is private.
Alright.
Okay.
Okay.
Could you please stand up with the palms facing forwards like this? I'll be verbalizing my findings to the examiner, so kindly bear with me.
Yeah, sure, doctor.
Ideally, I should have started my examination by examining the normal joint, but due to time constraint, I'm just focused on the affected one. On examination, an inspection, both the shoulders, both anterior-superior leg spine, both knee joints, medial malleoli are symmetrical in position. I couldn't appreciate any redness, any swelling, any deformity or muscle wasting on the anterior aspect of the right knee joint. I'll be going behind you now, Mr. K. I couldn't appreciate any redness, any swelling, any deformity, any muscle wasting on the posterior aspect as well. I couldn't appreciate any popliteal force or fullness. There is no scar. Could you please take a few steps and then lie down the couch for me, Mr. K? Thank you. Gait seems to be normal in my patient. Mr. Ken, now I'll be touching you gently for the purpose of examination. If you have any discomfort, let me know. I couldn't appreciate any localized rise in temperature. Now I'll be touching you a bit more deeply. Is it okay to proceed?
That's fine, that's fine.
I'm really sorry about that. Shall I continue?
Yeah,
Do you need any painkillers?
No, doctor.
My patient is having tenderness over the medial aspect of the right knee joint. Could you please bend your right knee joint for me? Thank you. I couldn't appreciate any popliteal force of fullness. I couldn't appreciate any tenderness on the posterior aspect of the right knee joint. You can now straighten. Sorry to bother you again. Could you please bend both the knee joints together for me? Thank you. Flexion is limited in my patient. Could you please straighten them? Extension seems to be normal in my patient. Thank you, Mr. King. Now I'll be doing some special tests, Mr. King, to find out what is the diagnosis in your leg, which is injured and everything. Okay.
Alright.
So if you have any discomfort, tell me. And so don't hesitate to tell me. Okay.
Alright.
So could you please go floppy for me?
Yeah.
Could you please bend your right knee joint? Thank you. I'll be holding your foot. Yeah. Medial stretch test and lateral stretch test is negative in my patient. Could you please bend your right knee joint a bit more forwards? Thank you.
I'm really sorry. Shall I proceed? Okay. Is that okay to bend your knee joint again?
Yes.
McMurray's test for medial meniscus is positive in my patient. McMurray's test for lateral meniscus is negative in my patient. Could you please bend your right knee joint for me? I'll be sitting on your foot gently. I'll be just pulling your knee joint and then pushing it back. Troyes test for anterior cruciate and posterior cruciate is negative in my patient. Could you please straighten your right knee joint? Thank you, Mr. King. I'll be just pressing upon your thighs, Mr. King. Patellar tap test is negative in my patient. I'll be just grinding your right knee. Patellar grind test is also negative in my patient. I'll be looking for your pulse in your foot and knees. Okay?
That's fine.
I could appreciate the dorsalis pedis. Could you please wriggle your toes, Mr. King? Thank you. Physiological function seems to be normal in my patient. Thank you, Mr. King. You've been very cooperative. Now we can press up. I'll be talking to you. Ideally, I'll examine the joint above and joint below. My most probable diagnosis, my patient is having injury to the medial meniscus since McMurray's test is positive. But I would like to confirm my diagnosis as soon as. Thank you. Okay, right now?
I have some pain, doctor.
I would like to give my patient painkillers.
Maybe you can
Are you okay now?
Yeah, better, doctor.
Okay. I'm going to examine your shoulder.
Alright.
For the purpose of examination, we need to undress above the waist.
Alright.
And I'll ensure adequate privacy since it is a private room.
Alright.
And I'll also ask my examiner to kindly be the sharp.
Okay.
Is it okay?
Alright.
Could you please stand up with your palms facing forwards like this? I'll be verbalizing the findings to the examiner.
That's fine.
So kindly bear. Sorry again. Can I know which is the affected one?
My right shoulder, doctor.
Ideally, I should have started my examination by examining the normal joint, but due to time constraint, I'm just focused on the pathological joint. On inspection, both the shoulders, both the elbow, both the wrist joint are symmetrical in position. I couldn't appreciate any redness, any swelling, any deformity, muscle wasting, both on the anterior aspect as well as on the posterior aspect of the right shoulder joint. Mr. Hills now will be touching you for examination purpose. Okay? Don't hesitate to stop me if you have any discomfort.
Okay.
I couldn't appreciate any localized rise in temperature. Now I'll be touching a bit more deeply now. Is that okay?
That's fine.
I'm really sorry. You okay? My patient is having tenderness over the lateral aspect of the clavicle. I'll be touching a bit more. Do you need any pain?
No, fine.
I'll be going behind you now. Could you please turn your face towards my side? Thank you. I couldn't appreciate any tenderness on the posterior aspect as well as on the scapular region. Now I'll be asking you to perform a few movements, Mr. Hills.
Alright.
Is that okay?
That's fine.
Okay. Could you please raise your arms from the front like this as much as you can? Thank you. Flexion is limited in my patient. Could you please bend your arm backwards like this as much as you can? Extension is also limited in my patient. Could you please tuck your elbows in your tummy and then move your forearm outwards like this as much as you can? External rotation is normal in my patient. Thank you, Mr. Hills. Could you please make a thumbs up sign and then scratch your back like this as much as you can? Thank you, Mr. Hills. Internal rotation is limited in my patient on the right side. Could you please cross your arms like this? Thank you. Adduction is normal in my patient. Could you please raise your arms from the side like this as much as you can? Is it painful here? I'm really sorry. You can drop that down. Can you try lifting it? Okay. Shall I assist you? Still painful? Still painful? Is it painful? Okay. Abduction is limited in my patient and painful arc test is positive in my patient. Now I'll be doing some special tests, Mr. Hills. Okay. Shall I proceed? Okay. Could you please move your forearm a bit? Could you please make a thumbs up sign? Now make a thumbs down sign as if emptying a can. Is it painful? I'm really sorry. Impingement test is also positive in my patient, suggestive of supraspinal intestinal test. Could you please bend your elbow? Try to resist my movement. Apprehension test is negative in my patient. Could you please straighten your elbow for me? And I'll be suddenly releasing my hand. So try to hold your arm in the same position. Okay. Drop arm test is negative in my patient. Thank you, Mr. Elsa. Could you please bend your elbow a bit? Thank you. Try to resist my movement now. Speech test is negative in my patient. I'll be looking for your pulse in your hands. could appreciate the radial artery. Please wriggle your fingers. Thank you, Mr. Hills. You've been very cooperative. You can press up. I'll be talking to you. Ideally, examine the joint above and joint below. The most probable diagnosis: the patient is having supraspinatus tendinitis since painful arc test and improvement test is positive. So, examination and discuss the diagnosis examiner. So, examiner, give me the task. I'll do it. And
Okay,
we'll go move on to
this is a 45-year-old male. His
new
name-
examiner.
Oh, sorry.
New examiner. Yes.
This patient, Mr. Williams, he had a
New name. Williams. Use
Mr. James.
Yes. James.
Mr. James, he had a fall from a ladder and he's feeling some pain in his back. And kindly do the examination and discuss the diagnosis.
James Bond. So,
Please proceed.
good morning, doctor.
Sure, identity.
Good afternoon, doctor. This is my GMC number.
Yeah.
I understood my task.
Okay. Please proceed.
Thank you. Hello, Mr. James. I am Dr. Moore, one of the doctors in this department. I'm here to examine your back. Is that okay?
That's fine, doctor.
For the purpose of examination, you need to undress completely, and you can stay in your briefs, and I'll ask my examiner to kindly be my chaperone, and I'll provide privacy since it's private. Okay, to proceed?
Alright.
Are you comfortable right now?
Yes, doctor.
Are you able to stand up?
Yes, doctor.
Please stand up with the palms facing forwards like this. Thank you. I'll be verbalizing my findings to the examiner, Mr.
That's
James.
fine, doctor.
So kindly bear with me. On inspection, both the shoulders, both anti-superior spine, both the knee joint, medial malleolus are symmetrical in position. I couldn't appreciate any kyphosis. I couldn't appreciate any exaggerated lordosis. I'll be going behind you, Mr. James.
That's fine.
I couldn't appreciate any scoliosis. There is no discharge, there is no redness, swelling, deformity, or muscle wasting on the back. Mr. James, now I'll be touching you for the purpose of examination.
That's fine.
Is it okay?
That's fine.
If you have any discomfort, let me know. I couldn't appreciate any localized rise in temperature. Could you please turn towards my side, Mr. James? Thank you. I'll be touching you a bit more deeply.
Alright.
I'm really sorry about that. You okay?
Yes, doctor.
Shall I proceed?
Yes, doctor.
My patient is having tenderness on spinal palpation in the lumbar region. I'll be touching you on either sides now. Okay? Tell me if there is any discomfort.
Alright.
Is it okay to proceed?
Yes, doctor.
Do you need any painkillers?
No, doctor.
Sorry. My patient is also having paraspinal tenderness in the lumbar region. Mr. James, now I'll be asking you to perform few movements for me.
Alright.
Is it okay? Could you please bend forwards and touch your toes like this without bending your knee joint? Thank you. Is it painful?
No, doctor.
Flexion is normal in my patient. Could you please bend backwards like this as much as you can? Extension is also normal in my patient. Could you please slide your hands, left hand to touch your knee joint like this? Painful?
No.
Okay. Could you please do it on the other side as well? Thank you. Lateral flexion seems to be normal in my patient. Could you please sit at the edge of the couch and hold your hands on the waist like this, and then do a sideways movement like this without moving your head. Lateral rotation also seems to be normal in my patient. Could you please walk a few steps and then lie down on the couch for me? Gait is normal in my patient. Mr. James, now will be doing some special test. Is it okay? Could you please go floppy for me and then relax yourself?
Yeah.
I'll be slowly raising your right foot.
Okay.
Is it painful?
Oh, yes, doctor.
I'm so sorry. Shall I proceed?
Yes.
Straight leg raising test is positive at 30 degrees angle in my patient the right side. Now I'll be slowly bending your right foot. I'm really sorry, Mr. James. Lasix test is also positive in my patient. Could you please turn, ideally I'll do the straight leg raising test on the opposite. Could you please turn towards the left side for me? And then bend your knee joint and then extend your thigh backwards.
Okay.
Bend your knee joint, extend your thigh backwards. Painful?
No, doctor.
Femoral nerve stitch test is negative in my patient. Thank you, Mr. James. Can I have a wisp of cotton? Mr. James, this is a wisp of cotton.
Okay.
I'll be touching at various parts of your leg.
Okay.
You'll be feeling like this. Okay?
Alright.
Whenever you feel a sensation like this, tell me yes. Okay?
Alright.
Could you please close your eyes?
Yes. 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 Yes.
Okay. Thank you, Mr. James. You have been very cooperative. Now you can dress up. I'll be talking to my examiner.
Alright.
There is loss of sensation over the L5 region. Ideally, I'll complete my examination by looking for the motor, power of the dermatomes, and then doing a complete neurological examination, and then looking for the anal tone as well. My most probable diagnosis, my patient is having disc prolapse. Most probably the level of prolapse is between L4 and L5, since patient is having loss of sensation over L5 region. But I would like to confirm my diagnosis. Thank you. If you have time, do power. Okay? I don't think so you'll have time.
Mr. Brown
Yes.
is having a swelling in his front of his neck. So could you please examine him and discuss with the examiner?
Okay. Good afternoon, doctor. This is my GMC number.
You can proceed.
Thank you so much. Hello, Mr. Brown. I'm fine. How are you? I'm Dr. Moore, one of the doctors in this department. I'm here to examine your neck.
Alright.
Is that okay for me to proceed?
That's fine.
For the purpose of examination, you need to undress above the waist, and I'll ensure adequate privacy and ask my examiner to finish. I'll be verbalizing my findings to the examiner, so kindly bear with me.
Okay.
Okay?
Alright.
On gross inspection, my patient is not overdressed or underdressed. His weight seems to be normal to side. Could you please raise your hands like this? Stretch your fingers.
Alright.
I could appreciate fine tremors in my patient. There is no clubbing. I couldn't appreciate any pallor, any koilonychia in the patient. Please show your palms for me. I'll be gently touching your palms. I couldn't appreciate any abnormal sweating, any palmar arrhythmia in the patient. Thank you, Mr. I'll be looking for your pulse now.
Okay.
Ideally, I'll measure the pulse rate for 1 minute. Due to time constraint, I'm just counting it for 15 seconds. Pulse rate is regular in my patient, 868 beats per minute. Ideally, I'll measure the blood pressure as well. I couldn't appreciate any alopecia. Could you please look up for me, Mr. Brown? Could you please look down? I couldn't appreciate any pallor. I couldn't appreciate any interest. Could you please sit erect and then focus at a distant object? Thank you, Mr. Couldn't appreciate any periorbital swelling. I couldn't appreciate any lid retraction. Could you please follow the tip of my finger without moving your head? Couldn't appreciate any lagging of this. Mr. Brown, assume at the same level, could you please look at the tip of my finger without moving your head? Tell me whenever you see devolution. Yes. You see devolution here? Thank you. My patient has ophthalmoplegia. Could you please bend backwards and look towards the ceiling for me? I couldn't appreciate any protrusion of the eyeball. Could you please stick out your tongue? Could you please roll it back? Could you please stick out your tongue again? Thank you. I couldn't appreciate any central cyanosis. There is no swelling that moves on protrusion of the tongue. I couldn't appreciate any fasciculation of the tongue. Couldn't appreciate any gynecomastia. Could you please tuck up your trousers for me, Mr. Brown? Thank you. Assume. Couldn't appreciate any pretibial myxedema. I'll be just gently pressing on your chin, okay? I couldn't appreciate any pedal edema. Could you please sit erect for me, Mr. Brown? Now I'll be examining your neck. Okay. I couldn't appreciate any redness, any discharge, any scar, sinus on the anterior aspect of the neck. Can I have a glass of water, please? Mr. Brown, this is a glass of water. So can you please take a sip of water and then hold it in your mouth? Whenever I say yes, could you please swallow it? Could you please swallow it? I couldn't appreciate any swelling that moves on deglutition. Now I'll be touching you gently for the purpose of examination. Okay? Can I have a glass of water? Sorry to bother you.
That's fine.
Could you please take a sip of water again and hold it in your mouth? And could you please swallow it now? I couldn't appreciate any swelling that moves on deglutition or palpation. Now I'll be looking for the position of the windpipe, Mr.
Alright.
Trachea seems to be central in position. I'll be looking for your pulse. In your neck. I could appreciate the current artery at the normal angle. I'll be going behind you now, Mr. Brown, to look for any swelling in your neck. Tell me if there is any discomfort, okay? Please sit erect and bend your neck a bit forwards for me. Thank you. Couldn't appreciate any swelling on the anterior aspect. Please bend your neck a bit forwards. I'm going to look for any other abnormal swelling in your neck. I couldn't appreciate any submental, any submandibular, preauricular, postauricular, or occipital group of neurons. You please turn your neck towards the left side. You please turn your neck towards the right side. There is no deep cervical group of neurons. Could you please shrug your shoulders for me? Couldn't appreciate any supraclavicular or infraclavicular group of pain. Mr. Brown, now I will be gently tapping you. Okay? Tell me if there is any discomfort. Couldn't appreciate any dullness on percussion. I'll be listening to your neck, Mr. Brown. Okay? Could you please hold your breath for a few seconds for me? You can now breathe in. I couldn't appreciate any thyroid breathing. Thank you, Mr. Brown. You have been very cooperative. Now I'll be talking to my exam. Now you can proceed. Ideally, I'll complete my examination by looking for the deep tendon reflexes and examining the cardiovascular system, also doing a sleeping pulse. Thank you. My only positive findings, I could appreciate fine tremors. There is ophthalmoplegia also in my patient. Apart from that, I couldn't appreciate any signs of thyroidosis. Tremors, fine tremors. I'm one of the doctors in this department. I'm here to examine your hand. I learned that you had a fall without Susan. I'm really sorry about that. You okay right now? Okay. Shall I proceed then? For the purpose of examination, you need to just roll up the sleeves up to the elbow joint, and then I'll provide you adequate privacy since it is a private room, and I'll also ask my examiner to kindly be the shot. Okay? Thank you so much. Can I know which is the affected hand for you?
My right hand.
I'm really sorry about it. So, place your hands over the pillow.
Thank you, doctor.
I'll be verbalizing my findings to the examiner, so kindly bear with me. Ideally, I should have started my examination by examining the normal joint, but due to time constraint, I'm just focused on the affected one. On examination, I couldn't appreciate any redness, any swelling, deformity, muscle wasting on the dorsum of the right hand. Could you please show your palms for me? Thank you. I could not appreciate any redness, any swelling, deformity, or any hypothenar muscle wasting on the palmar aspect of the right hand as well. Thank you. Now I'll be touching you gently, Mr. Edward, for the examination purpose. If you have any discomfort, let me know and stop the examination. I couldn't appreciate any localized rise in temperature. Now I'll be touching you a bit more deeply. Is that okay? Tell me if there is any.
Okay.
He's too good to charge.
I'm really sorry. You okay? Shall I proceed? My patient is having tenderness at the base of the right thumb. Mr. Edward, now I'll be asking you to perform few movements for me.
Alright.
Could you please raise your hands as if like pushing a wall or stopping traffic? Thank you. Could you please bend your hands like this? Both dorsiflexion and palmar flexion is limited in my patient. Thank you, Mr. Edward. Could you please tuck your elbows in your tummy and place your hands comfortably on the pillow, and then move your hands inwards like this, and then outwards like this. Thank you, Mr. Edward. Radial deviation and ulnar deviation is limited in my patient. Now I'll be asking you to perform some special tests. Okay? Could you please make a thumbs up sign and then gently tap upon it. So you might feel some pain during this procedure, so kindly bear with me. I'm so sorry. Axial loading test is positive in my patient. Could you please make your index finger pointing upwards and then do a similar procedure? You might also feel some pain, so kindly bear with me. Are you comfortable? Okay. My patient is also having pointing sign positive. I'll be looking for the pulse, Mr. Edward. I could appreciate the radial artery. Could you please wriggle your fingers for me? The neurological function seems to be normal. Thank you, Mr. Edward. You have been very cooperative. Now you can roll down the steps. Ideally, I'll examine the joint above and joint below. My most probable diagnosis, the patient is having clinical signs of scaphoid fracture. So pick up the X-ray, pick up the scaphoid cast, read the X-ray, check the identity of the patient, and treatment. X-ray, X-ray. X-ray suggestive of, there is radiological sign suggestive of this thing, fracture. Painkiller scaphoid cast for 6 weeks. Okay, I'll repeat it again. Painkiller scaphoid cast for 6 weeks. Ask him to come for a repeat X-ray after 6 weeks, whether to see the fracture line is healed or not healed. If it is healed, remove the cast, physiotherapy to prevent avascular necrosis, and then painkillers SOS. If it is not healed, then repeat the same procedure again. Painkiller scaphoid cast for 6 more weeks. Ask him to come after 6 weeks. If it is healed, again same procedure, same treatment. If it is not healed, we have waited for 12 weeks, so go for surgery. Open reduction and internal fixation. If it is fracture line is not there initially itself, but there are clinical signs, wait for 2 more weeks. That is, give him painkiller scaphoid cast for 2 weeks irrespective of the fracture line, and then do a repeat X-ray to see whether fracture line is there or not there after 2 weeks. Fracture line is there, same management. Fracture line is not there, bone scan, which is the next step of investigation. Bone scan to look for any hot spots or black spots. Hot spots, black spots not there, rule out scaphoid fracture. If hot spots or black spots are there only, then only do MRI, which will show whether scaphoid is really involved, and then make a decision on surgery. So this is how we will manage scaphoid fracture. So who's going to do the last orthopedic station?